This video is to further break down bony hip pathologies. So when we think about bony hip pathologies, the biggest cardinal sign that we're looking for is sharper pain in the front of the groin. So this pain oftentimes comes on with walking or weight bearing. The two major categories that we think about when it comes to bony hip pathologies are hip osteoarthritis and something called femoral acetabular impingement, or we can just say hip impingement. With hip osteoarthritis, what we typically see are people who are a little bit older and people who have had pain kind of come on gradually in a progressive loss of hip range of motion. Typically with walking, what we start to see is a lateral trunk lean to the affected side in efforts to kind of take some pressure off of that hip. Typically we'll see that sharp groin pain, pain with prolonged weight bearing, and pain with walking with hip osteoarthritis. With femoral acetabular impingement, we actually see a little bit of a younger patient population here. This population is somebody who has repetitive use of that hip, so somebody who's either in like a sport like soccer, or has recently gone into running or hiking. Anything that we have a rapid increase in stress on that hip, we'll see that kind of manifest as that sharp groin pain. Typically, once that pain starts, it's hard to kind of get that pain to go all the way away without some kind of intervention with an impingement of the hip. So those are our two major categories of hip bony pain. The general goal of rehab here is going to be to attempt to restore range of motion as much as possible, and then build the strength of the muscles around the hip, take the pressure off of the joint. If we get the muscles around that hip stronger, they're going to act like guy wires of a suspension bridge and take pressure off of the actual joint structure. So that will be our general goal with rehab. Phase one will be very focused on range of motion. And then as we progress through, we'll be more focused on like functional range conditioning and getting the hip stronger through its full available range of motion. This is the double knees to chest exercise. This is a great exercise for hip osteoarthritis because we can range into hip flexion without compressing the hip joint. This exercise is best done with a physio ball. What you're going to do is you're going to set up with both feet on top of the ball. You're going to slow and controlled pull the ball towards you, pausing when you feel like that hip is kind of running out of range, and then press back out. A good set and rep scheme here is 2 to 3 rounds of about 8 to 10 repetitions. So this end range here is hip flexion. This is a really gentle way to kind of bridge into getting some hip flexion range of motion. If you don't have a ball, you can still do this exercise. It might just be a little bit more difficult as we kind of have to hug the knees towards the chest. So using the ball, we can kind of use that opposite leg to even pull a little bit further. So whichever side is painful, you can kind of rely on the other side to help pull a little bit further towards that end range. However, if you don't have a ball, what you can do is called the double knees to chest hug. So you will kind of lift both legs up and then give your legs a little bit of a hug, hugging the knees to the chest, and then let them back down. So this is a nice way to kind of bridge that gap, or we can still get a little bit of that hip flexion, but this is just a little bit more of an advanced variation of that without the ball. This is the clamshell exercise. I love this exercise for hip osteoarthritis because it's kind of a double whammy. We're both going to get the hip stronger and more range of motion. So what you're going to do is you're going to set up on your side. The side that's up is going to be the side that's working. So you're going to set up on your side with both your knees kind of bent up towards your chest. So I'm not all the way up at my end range, I'm about halfway up towards my chest. Your feet are going to stay together, and then you're going to make sure that your hip bones are stacked on top of your hip bones. The thing that I see go the wrong most often with this exercise are people kind of rolling back. So your hip bones are going to stay on your hip bones. You're all the way on your side. From there, you're going to lift your knee up just until you're out of range of motion, pause for a second, and then back down. So this is working external rotation. The hip is a very mobile joint, and we're working to improve its mobility as we get it stronger in this range. A good set and rep scheme here is 2 to 3 rounds by about 10 to 12 repetitions. If this feels easy for you, you can add a band between your knees to add a little external load. Again, this is the clamshell exercise. This is the reverse clamshell exercise. You're going to set up on your side with the top side as the working side. It's usually more comfortable if we take a small towel roll and tuck it between the knees That way our knees aren't kind of rubbing together or placing a little extra load on that outside of the hip. So tucking a small towel roll between the knees, what you're going to do is you're going to slow and controlled lift your foot up towards the ceiling and then back down. This is a little bit of a double whammy exercise. We're working both hip internal rotation, range of motion, and we're working the muscles to get a little bit stronger here. So we're both getting more range of motion and we're getting stronger. Try to work all the way towards your end range here. Okay, a good set and rep scheme would be 2 to 3 rounds of about 10 to 12 repetitions. If this feels easy for you, add a band around your feet. And now add a little external load to the exercise. This is the reverse clamshell exercise. This is the bent knee fallout. This is a great way to get a little bit more hip range of motion and also start working on some lumbo-pelvic stability. What you're going to do is you're going to slightly tuck your hips. So I tell my patients in the clinic, imagine you have a belt buckle on and we're tucking that belt buckle towards our nose. We're going to hold that kind of lower abdominal contraction that makes that happen, and then you're going to let the involved leg fall towards the floor as far as it'll let you go comfortably. If you're hitting a pain point, don't push beyond that pain barrier, and then pull that knee back up. The important thing here is we're making sure our core stays engaged. So making sure that we're not rolling through that top hip to make that motion happen, but we're kind of keeping that core stability as we let just that hip fall. That way we know that we're only getting this motion through the hip and not through the pelvis. Okay, so we're going to go for about 10 to 12 repetitions here to try working on some hip range of motion and some lumbo-pelvic stability. This is an exercise where it's probably best to do on both sides. This is called the bent knee fallout. This is the standing hip extension exercise. You're going to take a short loop band and you're going to place it around your ankles. We're going to keep our core tight, and what you're going to do is you're going to take a long step backwards, squeezing and engaging your glute, and then bring your feet back to that neutral stance. Take a long step back, squeezing and engaging that glute, then hip back to that starting position. This is kind of a double whammy exercise because we're not only getting our glute stronger, but we're also kind of working into hip extension. A big thing here is making sure that as we reach back, we're not countering that, so we're standing tall through our skeleton, trying to imagine ourselves getting as tall as we can, keeping our core engaged as we step back. That way we know we're getting true hip extension. I see a lot of folks with hip osteoarthritis really struggle to get into that hip extension, and this is a nice way to kind of bridge into that position. A good set and rep scheme here will be 2 to 3 rounds, 8 to 10 repetitions. If balance is an issue for you, make sure you're next to something to kind of hold on to, and we don't want bounce to be the limiting factor here.